Oh, Julie.
Yes.
We're back again.
We are back.
Here we are. We had a busy day today.
We did.
But
one of us even changed clothes.
One of us did. The other just took a hat off, and it worked out great. But we have the cherry on top today because we have a dear, dear friend of mine. I'm going to give a little lead up.
Okay, please do.
Before so.
Ooh, I'm excited for this.
Actually, I have a little spiel. Let's start with that. You know, it blows my mind that I've hit 40 years old, and thankfully, I don't feel...
Past 40, over 40.
Excuse you? 41. You know, it blows my mind that I've hit over 41 years old. Thankfully, I don't think I look 41 years old. Julie, do you agree? Yes, you do. I feel like I look younger, like mid to late 30s.
Someone did tell you that recently, so I accept.
Yeah. I paid them very well for that compliment. But I would like to keep it as long as possible. I moisturize. I hydrate. I drink lots of water, of course.
Sunscreen?
Sunscreen. I don't really go out in the sun.
Right.
But I know eventually it catches up with you.
Mm-hmm.
Thankfully, one of my closest friends here in Vegas is the owner and founder of one of the most successful, it's a med spa, right? That's what you call it?
Med spa, yeah.
One of the most successful med spas, not only here in Vegas, but also 2 locations in Utah. Boston Crockett from BosBeauty. Welcome to the show.
Hi.
Boston.
Thank you for having me. This is so fun.
Oh, I'm so excited. This is your first podcast you've been on,
It's my
right?
very first podcast.
How you feeling?
I mean, I'm just excited to be here.
Yes.
But yeah.
Anytime we get to hang out with Boston is always a pleasure.
I know. I'm just excited to meet you.
Thank you. So excited.
Julie's heard so much about you.
I have.
Thank you.
All good things.
Yay.
One bad thing.
Oh.
No bad things.
Tell me. You tell.
No bad thing.
The only bad thing is she doesn't curse.
I wouldn't say
Correct.
that's bad.
Yeah.
I think it's really polite. I think it's sweet.
By the end of this episode, I'm gonna get her to curse.
Maybe.
We'll see.
Oh gosh. Okay.
So, just a little info of what BosBeauty offers for those of you that are home that have no idea what med spas do, no idea what BosBeauty is. It's basically you offer services like Botox, fillers, lasers, skin treatments. Brian, penile injections.
Yeah.
Stop. What do you mean stop?
Brian.
I'm just-
Brian.
I mean, you offer a tremendous amount of more, but can you give us your spiel as to what BosBeauty is?
Well, we do everything beauty related, anti-aging, body contour, weight loss, like you said, lasers, IPL, CO2, Morpheus 8. Yeah, we have everything that you need at BosBeauty. Botox fillers, all the things.
For men and women.
For men and women, yeah.
Obviously, I'm assuming, what percentage of your clientele is women compared to men?
I would say 80.
80?
Yeah. 80%,
I feel like 20 is still a good percentage to be male, though.
Yeah. I also feel like males don't know much about that realm, and so if they just need to know more.
Let's hopefully by the end of this episode, they're well versed in everything BosBeauty has to offer.
Let's hope.
Yeah. And we changed that from 80-20 to maybe 30-70, maybe 40-60.
Yeah, I'd take it.
Who knows? So obviously, just from the brief few things you've said, it sounds like you know what you're talking about. But give us a little bit of your education. So for people that are listening to this episode, they know that you're not just spouting off nonsense, that you actually know what you're talking about. What's your background?
Well, I've been in this industry for over 10 years.
Mm-hmm.
I have my DNP, which is my doctorate, so it's the highest level of nursing you can go.
Should I refer to you as Dr. Crockett when you came on?
Could.
God, I'm already
You
off to an
messed up.
awful start. This is so embarrassing.
No, I mean, have you ever heard of imposter syndrome?
Yes.
I have that so bad.
Really?
I'm good with Boston. Like, yeah, you can call me whatever. But yes, technically I do have my doctorate, so.
Good for you.
Hell yeah.
Yeah.
I've never heard anybody with the name Boston, by the way. That's a phenomenal name. And me being from Massachusetts, I love the name.
Thank you. Yeah, it's different.
Yeah. Why did your parents call you Boston?
There's not a cool story. I get asked this all the time, and I want to make something cool up, but my mom worked at a nursing home. She knew an old lady named Boston. She was like, I'm going to name my daughter Boston one day. And then here I am.
It's cute.
So,
Shout out to
thank you.
Grandma Boston.
I do have a secret, though. My first name, it's my middle name. Boston's my middle name.
Oh, what's your first name?
Yeah. So I know nobody knows, but it's Camille with a K. Camille Boston Crockett. But I've only ever gone by my middle name. So
Why?
To be fair, my best friend's name is Camille, so I'm in.
Really?
Now hers is with
Yeah.
a C, but
Yeah.
you have the best name ever if you ask
thank
me.
you.
Why do you not go by Camille anymore?
I mean, Boston is kind of cool. Like,
very cool.
yeah, right. And then honestly, my mom just always called me Boston. So that's just what I've gone by.
Love it.
So explain to me why you opened up your own shop. Because so many people could have easily just gone the route of working for someone and having that be their career for the rest of their life. Why did you decide to open up Boss Beauty?
Well, my dad is a business owner. My mom is a nurse, and I feel like I got to see the business side of things growing up. So it happened very organically. When I was injecting, I was working for myself, but I was working under a doctor. Like a doctor had to prescribe my medications and sign off on patients. And so I started to build out my clientele, and eventually it got so big where I was booked out 3 months and more, and they were starting to get mad. My patients were starting to get upset because I couldn't fit them all in.
Yeah.
So I was at this point where I either had to hire somebody or had to lose them. You know, like all the patients are going to go somewhere else, or I can trust somebody. And that was so hard to open myself up to like that idea of trusting somebody with all my patients, because they're like my family. I love them, I get to know them, and I really care. So anyways, I had to hire somebody, and then I hired my first person, and it just kind of like escalated from there, and it's become what it is.
Once
But
you get a taste of being a business owner, you'll never want to give it up.
no,
Never. You'll fight
amazing.
tooth and nail. You'll do anything it takes to never have to work for someone other than the customer or the client.
Yeah,
ever again.
pros and cons for sure. Like I'm so blessed. I like you said, I would never trade it. I would never go back. But at the same time, like sometimes it sounds really nice to just drop everything, go home, and not have to think about anything else, you know, for the rest of the night. But yeah, no, I would never trade it for sure.
So I've recommended you to a handful of friends, and even one of my friends' fiance has booked a consultation with you. You're so busy that even just a free consultation with you is weeks out.
Yeah.
In terms of how many people you see a day, or how many people that your team sees a day, what would you say the average is?
I mean, it kind of ranges, because if I have multiple providers, then it goes up. You know, typically I try to have one provider at least a day, and then sometimes we'll have multiple. And then we have estheticians working as well.
Yeah.
And so I would say 20, if I have multiple providers, maybe up to 40.
That's wild.
That's so
in one location.
So all three though. I know St. George is Salt
St.
Lake.
George. Yeah, St. George. Salt Lake is the newest.
Yes.
Yeah.
Is Salt Lake going as well as you thought it was this early on, or is it still too early to?
I mean, there's so much room to grow always in all of them. So growth is endless. But I feel like in Salt Lake, I mean, it's a good start. It's not where I want to be because we're brand new, but we started out with still patients every day, which is great. And it's escalated from there, and it will continue. But yeah, it's a good market.
You're headed in the
we're
right direction,
growing.
at least.
Yeah.
What do you think has been like the biggest driver of your growth? Is it like social media or word of mouth, or just like clients having results and you sharing that on your website, or what do you think?
Word of mouth for sure is probably number one. And then also social media. We do a ton of social media. It's all in-house. And actually I've just started to like gamble into like the realm of let's hire people for that.
Look at you.
But yeah, I do. We do all in-house up until like a few months ago, and then word of mouth. Yeah.
One thing I like about you and just your social media is you're a little goofy. You can be a little fun. You have fun on social media.
Yeah.
You're very funny in person, and you're very quick-witted in person. I've been telling her this, but on social media, you go all out. I think it's very
Thank you.
it's,
We have
it's
fun,
very
for
uncommon
sure.
to see.
Thank
but I
you.
love that.
Yeah.
But yeah, definitely word of mouth, because you guys, especially the two early ones, the Vegas one and the St. George one, you guys are always booked.
Yeah. Yep.
Good for you.
Yeah. Those ones are booked for sure. Those two locations.
What part of being a business owner still stresses you out?
Unrealistic expectations for patients, I would say, just because we really try to give that for them when they come in. But it's just, you can't make everybody happy. And I want to. Like, I have that desire inside of me that really wants everybody to be happy. And sometimes you just can't. So that would probably be number one. And also, like, there's always things that could go wrong with injections.
Sure.
So just, worrying about patients and making sure that everything turns out okay. And
That's got to be terrifying. The fact that you or somebody on your team could slip up and something bad could happen. And I know it's very uncommon because you're very professional and you have plenty of experience. But to me, that would always be in the back of my mind. If I was in your shoes, I'd be terrified that I'm doing something wrong and all of a sudden the worst case scenario happens.
yeah, I mean, to an extent, it's healthy because you also want to make sure that everybody's safe.
And you
And
have
so,
to care.
Yeah, so I don't want to get too comfortable ever.
Yeah.
I always tell my girls,
Good.
like, we cannot get too comfortable. We always have to make sure we're doing safe practice.
Being that Vegas is very appearance heavy, appearance matters here in Vegas.
It does.
What type of clientele do you typically serve?
Well, I mean, female between 20 20 and 50 is our norm, but we have a lot of young girls because I mean in Vegas there's a lot of bottle service girls. There's tons of people that just need to be seen everywhere all the time. So I feel like looks is very important in Vegas, and a lot of young girls.
What's your
20s, 30s?
Sorry.
No, you're
What's your most common service requested in Vegas?
I would say Botox.
Botox?
It's the gateway drug. Always. Yeah.
I think about it constantly.
Really?
Yeah,
Have you
I'm-
never got it?
No, I'm saving for it.
Oh my gosh, babe. Yes, you have to get it.
I know.
Come see us.
Yes, babe.
Yes, babe.
Everybody's like, you have to do it, and I'm getting ready to turn 27, so I'm like, I feel
Yeah.
like that's a good age, and I want your
It
opinion
is.
on that too later.
Yeah.
But I feel like that's a good age to like at least start.
It's prevention.
I know. Preventative
Just do a little
Botox.
bit. Yeah, just a little bit.
I know.
And then, yeah.
And I
Long
speak
term.
with my eyebrows so much that I need it.
Yeah. we
Julie's.
got to get rid of any RBF.
Yes.
I don't think you can
For
get rid of it
Andrew.
completely. I was about to say
I have a permanent.
it's sticking around,
Yeah, for Andrew.
unfortunately.
Julie is very expressive with her facial expressions.
Yeah.
too.
I am.
Yeah, I can usually tell when she's getting mad at me.
Everyone knows what
without
I'm
saying
thinking
anything. Yeah, everybody
constantly.
knows what you're thinking.
Yeah.
Is
Which isn't a bad thing, always.
I take it. Listen, she's fantastic. I love it. Is Brotox more common these days? Guys getting Botox?
Yeah.
Yeah?
It's more common for sure than it used to be.
Yeah.
10 years ago when I started, I wasn't really doing guys.
Yeah.
But yeah, it's definitely more common. We still need to amp it up. So hopefully we'll get some more guys.
When you're walking around and you are dealing with this and you're out in public, do you look at people and just judge what you would do to them?
Always, yeah.
Do you?
Yeah, all my friends make fun of me because they're like, Boston, just stop. Because even them, I'm like, I feel like I'm doing them a favor. Like, babe, we need to do Botox.
I feel like you're like the
You know?
Terminator and you're analyzing everybody that walks in. It's like a scan and you're just scanning me or scanning Brian and
Yeah.
you come to your conclusion.
I
Yeah.
feel like we all need a friend like that, though, to some degree.
Yeah.
Like, don't pick too hard.
Yes.
But, like, to some degree, we all need it.
Yeah.
Well, fortunately, the reason Boston is one of the many reasons why Boston is incredible is she doesn't hold back, especially if you tell her not to hold back. She'll go no filter. And what we have her doing today, later on in the show, is you brought a dry erase marker,
I did.
and you're going to mark my face
Yeah.
as to where I should.
It's permanent marker, actually. Andrew.
Perfect, even better. I want everybody to know. And Julie, very little work, I'm sure, needs to be done on Julie, not as much as me, but
I still want to know, though.
we
Yeah.
still want to get marked up.
Yeah, let's
so
do it.
don't hold back on us.
Okay.
Perfect.
Yes.
I will. I'm excited.
Do guys, when guys are coming to you and they say, hey, I need Botox or whatever, are they bashful about it? Are they shy about it? Do they just not know what they're talking about when they come to you? How do you ease them into it?
Most of the time, it's their girl that brings them.
Yeah.
So, their girl is the one that's more vocal, saying, hey, "You need to freeze this. Yeah, can we make this a little bit better?" So yeah, I would say when guys come in by themselves, they are a little bit. They don't know what they're doing.
Yeah.
If it's their first time, they're like, "What do you think I should do?" I have some movement that's kind of starting to bother me, and then we just talk about it.
All right, so let's say I walk in. I don't know what's going on. It's the first time I've ever been in a Boss Beauty. Like, hey, I'm 41. I need help. How can you make me? Do you want me to look younger, or do you want me to just have a less angrier face? First of all, what's your strategy when you look at me?
Yeah. Well, I would ask your goals, what your goals are. If
I don't
you,
know. I don't want to look
Okay.
41.
He just wants to
Okay.
look better,
Just-
but he doesn't know what
Yeah.
better means.
Okay. Well, definitely we're starting with Botox for sure.
Definitely.
We're gonna relax some of those lines
Brian,
we got
can you
going
mute
on.
Julie's microphone for the rest of this episode? I don't know if I like her comments right now.
She said definitely. I just repeated it.
Yeah, just softening those fine lines, wrinkles a little bit. And I would say, are you open to fillers?
I don't know. What are fillers? Is that like my lips? I don't want my lips done.
So filler fills volume loss,
Okay.
and Botox only affects the muscles.
Okay.
So volume loss, like under the eyes, we have like a little bit of Halloween going on. So I would love to do some filler under your eyes.
Julie's
So funny.
loving this episode.
are
Julie
so
is
funny.
just soaking it all in. All right, so fillers,
Yeah.
Botox, what else?
Lasers. I love starting.
Lasers?
Yeah, lasers. I know it sounds scary,
Little
but
bit.
it's really not scary. I promise. It's actually, to me, it's like the most natural with lasers, Morpheus 8, all those things that build collagen.
Mm-hmm.
It's going to be longer lasting, more natural looking,
Mm-hmm.
and we can do less fillers down the road.
I don't know about any of that. I don't know what any of that is.
Yeah. Well, you just need to come in and see
the good thing
me.
is, the good thing is I don't need to know what it is. As long as you know what it is, then I
Yeah.
trust your judgment, then so be it.
A CO2 resurfaces your skin.
Mm-hmm.
So it helps with fine lines, wrinkles, pore size, tightens your skin up, builds collagen.
We like that.
Yeah, we love all that stuff.
We love that.
Yeah.
Yeah.
So we'll do that first, and then we'll perfect with the Botox and the filler.
Now, I know obviously every service is probably going to have like a different time frame, but what is the length of like an average appointment if someone's getting like one service done versus like multiple, if that makes any sense?
Yeah. Well, Botox typically takes like 15 minutes, maybe 20 if I'm spending time talking to them and assessing them. A little bit more maybe with a consult, but fillers can range. It usually goes from like 30 to an hour, 30 minutes to an hour.
Why does it take so long?
For filler?
Yeah.
Yeah, filler it's a little, it depends on where they're getting it. So for example, with cheeks, it's really fast. It's like 10 minutes. Under eye, I mean, just because you really want to be so careful, you know, you take your time, talk about everything. Yeah, ask what their goals are, that kind of thing. And then if they add from there, so if you do more fillers in one session, I mean, it can take an hour-ish, depending on how many they add. So if we're doing like 3 or 4 in an hour.
What's the longest a client has been at one of your med spas, like in a day?
Oh my gosh, where they've spent, I mean, we have patients come in for sometimes hours. They're there like 3-4 hours.
I mean, good for them.
Good Lord.
Yeah.
I would love to.
Yeah, they're like, do it all. Let's do it all. So we have a whole plan.
We're total package.
Yeah.
Yes.
Doing a bunch of things.
How long if say I get Botox, how long would it last me?
If you're at max dosage, 3 to 4 months.
Okay.
So, yeah.
What does max dosage mean? Because I would assume that a lot of our listeners probably don't know.
Yeah. So it's done by units. So we inject you. Maybe I should say what Botox is, first of all.
Yeah.
Because they might not really know. So neurotoxin, so Botox is a brand. It's a neurotoxin. There's 5 that are on the U.S. market. They're FDA approved. And it is a protein that goes into the muscle, and it releases acetylcholine, which blocks the muscle from moving, from contracting. It's the messenger to say, contract. So when you relax that muscle, it helps with fine lines, wrinkles, like I said, the pore size, kind of gives you this like nice glow, shine to your skin. It's an anti-ager, it's prevention. But yeah, so Botox, I'm sorry, what was your question? It was
The question is, you said max dosage.
Yes.
Because we were talking about how long it would last him.
Yes. So if let's say I put in this muscle, we call it the glabella. If I put 20 units in that muscle, so 20 units
It's called a what?
So to you, it doesn't
glabella?
mean, it's called the glabella. It doesn't mean, like, units don't mean much to you, but at max dosage, I would just say, like, typically plan on 40 to 50 units in this muscle to get completely frozen. Sometimes it can take more for a guy's muscle because theirs are stronger. So typically 1 to 3 times the amount of a female muscle. So when I'm going in with him, I'm going to do a completely different dosage than you. But as far as units go, I mean, it's just really not going to mean that much, but just know, like, to be frozen for you in the glabella, it's going to be 40 to 50.
I'm going. I'm getting the total package. I'll be there for 3 hours.
Yeah.
Watch me.
Well, and then back to his question.
Yeah.
So let's say you successfully froze his glabella.
Yes.
How long does that last for him before he has to come back?
At max dosage, so that's going to last 4-ish months, 3 to 4 months. Yeah, and I'll just kind of give you like a little visual. If you have this muscle, it's a free moving muscle. If I put half of the dosage that needs to freeze the muscle in there, it's now not going to move like this. It's going to move like this. And then if we want to get it more frozen, you put more in, and now it can't move at all. So it relaxes and it can't move.
Can you tell when a guy or girl has a bad Botox session or injection or whatever we call it?
Yeah. I mean, with Botox,
With
yes,
other brands, not BosBeauty.
Yeah,
Of course.
yeah, not of course. Yeah,
Obviously, come on.
Yes. So, I mean, typically with Botox, like if there's one brow up and one brow down, you know, that's an obvious issue. We have seen it, but I mean, it's not as common. Like, I feel like people usually know what they're doing, where they're not going to cause one brow up, but I mean, it can happen. It's so it's not unheard of, but yeah, you can visually see that, you know, so you're like, okay, we need to go in and change that. I would say the more common thing that you see is people don't get frozen enough, where they have a little bit of lift still above their brow.
And you can tell.
And so then, where it's not like one brow up, one brow down, they both pop up a little too much than what they're wanting. And so then we just go put a little bit more in 2 weeks later, and they're good to go.
How about that?
Yeah.
All right, so all this talk about Brotox and Botox, are you ready to mark me up and
Yes.
show what you would do to me?
Yeah.
So I don't know how we're going to do this. I think we're probably going to have you I'm going to move over. I'm going to move this way.
Okay.
Brian is going to direct you to stand here.
Okay.
And maybe don't stand in front of the camera, but stand on the side and just have your way with me. Have your way with my face.
Fun.
Get over here.
I mean, I have done this before.
Yes, but not publicly and not amongst all of our listeners and viewers. You got the gloves on too?
I mean, I thought it would come a little professional. It's like
We actually asked Boston if she would inject us live on air, and she said, legally, you cannot.
it's not like he needs me to alcohol his forehead, but typically I
do
will
it.
just clean you off really good. So we're just gonna do that.
Paint me like one of your French girls, Boston.
Love it. Okay, do we want me
Yes.
to mark around the eyes too?
I want
just
it
the
all.
Forehead?
I want it all.
Whatever you would do to him
Give
in
me
a
the
normal
Boston-
consultation.
Give me the Boston total package.
It was so funny when he was like, "Can we do it with a permanent marker?" I was like, "Sure, Andrew." We can do
Oh, I
whatever you
thought I
want."
didn't know. I didn't know the system here, the process.
So I like to see the movement. So go ahead and push the brows in as far as you can. Perfect.
Mm-hmm.
We're gonna do some here, here. This is your glabella muscle,
That's what I thought it was. Yeah.
What does he need? 400 units?
right?
Just 20 at the max.
I mean, if we're really wanting to change
Maybe
his
40.
face, yeah. No, he needs a good amount.
I don't want to
Go
look
ahead,
like a
scrunch down for me.
mannequin.
Scrunch down for me.
Like this.
Scrunch down for me, babe.
What do you mean scrunch down? Like this? What's
Yeah.
down?
No, push your brows together. Okay, now lift up as high as you can. Perfect. We're going to come in
I feel like I look
here.
ridiculous right now.
Keep
You
on
do.
going. Lift high. Perfect. I know. Hopefully my marker's dark enough so I can see it.
I have very white skin. I'm sure it'll stand out.
There we go. So your frontalis is wide.
Excellent,
you got
right?
You got a strong one.
Thank
yeah.
you. That's
What's
what,
his frontalis?
That's what my mom always said.
It's this muscle. So
Oh, like his whole forehead.
So this is the glabella right here.
I have a very strong forehead,
and then his
Julie.
frontalis is when he lifts his muscles up. So you have the muscle that pulls down,
Yeah.
contracts down, and then you have the muscle that contracts up.
Okay.
I have a very
So-
strong forehead.
And his big forehead does a good
Well-
job at lifting up.
It's a 5 head.
Yeah, so he can move his muscle right now, so he's pushing it up. So typically when you pull your muscle, yep, that's the glabella here. Just going in here. And then lift up high for me. Perfect.
She's spending a lot of time on your forehead.
It's a big forehead. Why do you think this show's called Big Head, Julie?
I know.
It should have been called 5 Head.
Okay, and then smile really, really good. Okay, so this is a orbicularis oculi muscle around here. It's a sphincter muscle.
Sphincter muscle.
I know. Is that fun to say?
On his face.
I feel
Yeah.
like you just made that up. You definitely just made that up.
No, it's just got a cool name.
Mm-hmm.
Okay. And then if you want a little brow pop, we'll put some right here.
Yeah, pop those brows.
Yeah,
Am I still smiling?
you are still.
Don't forget about
My
his
marker's
Halloween
not very
eyes.
good,
My Halloween
but
eyes.
we got it.
Is that it? We
Yeah,
done?
but my marker's not very dark, but we got it.
Can we
So-
tell? How do I look?
Can we see it?
Can we see it?
Can you see it?
I can't really see.
Can't really see
Should
it?
I star them so they're?
Yes. Work your magic. I want to be
Okay.
starred.
Lift up. I know my marker is just failing me right now.
We need to get a Sharpie then.
Right? A little darker. And you have a really high one, so go a little bit higher in there.
Mm-hmm.
And
Well, and what we can always do too is we can take a picture of you, and then during this part we can always throw up a picture of your. Oh, look, Brian to the rescue,
you have, oh, nice.
black and red.
Perfect.
Thank you. That's perfect. Okay, and then scrunch your brow together for me. Perfect. And then squint your eyes really good. Sometimes I go a little bit closer in here, depending on what the person is wanting.
Mm-hmm.
Are you going to come in and get this now?
I'm right after this episode. We're doing
Okay.
it.
Let's take a look.
I feel very comfortable. You make the patient feel very comfortable.
God, you look like you have chicken pox. Pretty bad.
It's not contagious.
And then lift up really, really good. Yeah.
I don't know,
Sometimes
something-
The patient doesn't want movement above their brow at all, but you're a guy. I feel like guys still have to have a little bit of movement, you know? to
Okay.
look more natural.
Let me see.
Girls like to be frozen.
Let's see what I look like.
You look sick
Okay,
right now.
I do
we're gonna
look
come in.
I do
let's
look
take a
like I just came
picture.
from 1891. I had smallpox. Yes. Take a
We'll
picture.
do exactly this.
Yes, all right,
when
ready?
You're in, and
You-
then we
you're
can
in it
do a
too.
Before and after. Okay. Yay.
Love that. All right, we're getting all these. Oh my gosh.
So fun.
It's not contagious, I swear. So in terms of other 41-year-olds that you've had come in,
Should I go say it?
well, I want you to do Julie next for sure.
Oh.
But in terms of other 41-year-olds that come in, 41-year-old males, am I along the same demographic as them? Am I much younger looking than other 41-year-olds? Am I much older looking than other 41-year-olds?
I would say you are.
Talking to the mic. I want everybody to hear.
He looks 52. No, I'm joking. I'm just joking.
After
No,
everything
you
we've
look-
been through.
You look like late 30s, I would say.
I'll take it.
Yeah.
I'll take late 30s.
Why do people keep saying that to you
Has
lately?
he done Botox before? Can
I've
I
done
just
Botox.
clarify?
I've done Botox from Boss Beauty.
Have you really?
It changed my life, yeah. It was
Whoa.
great.
Just
Yeah.
once?
Twice.
Oh, okay.
Yeah. Long time ago in a galaxy far, far away.
Awesome.
I know. It's preventative, Julie.
It is preventative.
Yes.
It prevented you from what, like 3 years? You look in your late 30s instead of 41.
Julie just hates when I get complimented.
Before he looked literally 50, so.
It was the pandemic.
Believe it. I would
It was a
believe it.
pandemic. It was a weird time for all males at that time.
It's a weird time for everybody. Don't make it just about men.
I'm making it just about me. Just about me. All right. So Julie's 20-something.
About to be 27.
About to be
Okay.
27. Happy early birthday.
Sure.
Whatever that is.
Early for the year, I
Early
guess.
for the year. Preventative Botox.
Yeah.
I'm assuming that's a thing, but
Yeah.
what's the purpose of it besides the obvious of preventing wrinkles?
Well, I mean, that is really the reason to
Right,
prevent
isn't all
wrinkles from
Botox
forming.
preventative Botox, but I feel like people have just been calling it that lately.
Well, you can either get treated for fine lines. People come in and say, "Okay, I want to treat these fine lines wrinkles." They didn't do it as prevention. Now they're static lines. Static lines are lines that they have at rest because they've been moving the muscle so much.
Oh,
now
I
they've
have
formed
some of
lines.
those.
Yeah, so even when you're not moving your muscle, you have
You
lines
totally
now.
have those, Julie.
Dude, I know.
Jeez, I see it now. It's
What
all
are
I
these?
see.
These are the Wi-Fi lines. Is that what that is?
Yes. Yeah,
call
we
them
can, it's
Wi-Fi
okay. You're not too far gone. Okay.
Thank
we
you,
can-
thank you. Okay.
We can take care of those. Yeah. So prevention is when they prevent those static lines from forming.
Okay.
And then when somebody comes in and they sometimes need more than just Botox, which we have,
Mm-hmm.
and we can create a care plan and, give it a year, your face will change. So if you're consistent, yeah. you
So
can-
I have to
you can
go
take care
in.
of those.
I have to go in at least 2 or 3 times a year to have my face change for Botox.
Yeah, so it's indicated for 3 to 4 months at max dosage. So 3 times a year
Uh-huh.
if you do a max dose. Yeah.
And then can you give me a ballpark of the
Cost?
cost? Yes.
Yes.
Because a lot of people are going to be curious. as to-
Yes. So somebody that's doing preventative Botox, I would say you can get away with like $300, $400.
Mm-hmm.
Somebody that's wanting to be frozen and wanting really to treat their face, their wrinkles, I would say plan on like 600, depending on the person. Sometimes 800, so 600 to 800.
Beauty isn't cheap.
Yeah. I mean, you guys, we do our hair, every like 3 months, and it's $1,000, you know?
Yeah.
So yeah.
Hold on.
Sorry, I was laughing because your hair looked absolutely insane for a second after you sat up. That's why I was laughing a minute ago.
Hold on.
think I
You
got
pay
the hair.
$1,000 to get your hair done?
Yeah. I mean,
fucking kidding me?
sometimes,
Her hair
yeah.
looks really nice. To be fair, I do my own hair at home, but our hair looks very different than each other.
I have extensions right now, so it's not all mine.
Yes, babe.
Yes.
Nice.
babe.
Yes, babe. All right. Well, then, obviously, Botox/Brotox is one of the many services that you offer, like we said. I want to dive more, and Brian keeps messaging me about this. And Brian, we're getting to it. I'm
Seriously.
sorry.
Oh gosh. Oh gosh.
Stop.
Can you please talk to us about penile injections that you offer? And by the
Yeah.
way, Brian, feel free to pull up the before and after photos that she has on her website. They're very graphic and very informative.
We had consent to
Yes,
post that.
as I'm sure.
I would
I'm
assume.
sure I would hope
Yes.
so. Yes.
So penile filler. I mean, it's HA filler, hyaluronic acid filler that we're putting in there,
Put
and
an acid in a penis.
well, it's hyaluronic acid, so it's basically like water, like gel form of like water. It's
Oh, okay.
just it's hydration.
Am I wrong for believing that's in like some of my face washes?
Yeah, no, that's right.
Okay.
Yeah, there's a lot of products.
I feel
that
like
have it.
I've seen that
Yeah.
ingredient. Okay.
Yeah. So you put it in. It helps with girth. It can sometimes help with length, depending on how it's put in.
Girth or length? What's more important?
Oh gosh.
Okay,
I mean,
let's frame
can
it.
I-
What do people come in more concerned about? Not what are Boston's own personal opinions.
I mean, answer
Yeah.
whichever question you want to answer, Boston. That's fine.
I would say girth.
Girth?
I would say girth. Yeah.
Girth, okay.
Yeah, they're
more
wanting
concerned
more
about
girth.
that. Okay.
Yeah.
More about the soda can than anything. That's good to know. So how do you differentiate between girth and? So you said it does girth and length.
So it can add a little bit of length, yes. When you have more volume, yeah, it can push a little bit out. But yeah, it's more for girth.
How long does that process take?
About an hour, not too long.
And where do you inject it at?
We
In the
numb
shaft
you.
or like in the side of it or what?
Yeah, in the shaft, we numb you, and so you're comfortable. We also have laughing gas, which is amazing. So if you're nervous, it takes the edge off. It's really good.
Is there like a weird healing process for that, or is it just like any other shot injection that someone might be used to?
Any other shot and injection, you can expect bruising and swelling, but yeah, nothing crazy. I mean, yeah, not too bad.
So let's say I come in. I want to be girthier if I say so. How
He was so excited about this segment. He was like waiting.
All he's
anytime we
thought
get-
about is penises
Do you
all
want
day.
some, Andrew? Do you want some?
Want or need?
Real question.
It's
Real
different.
question.
Let's get his girlfriend on the line.
What matters more to you, length or girth?
I'm a grower, not a shower. So does this help with
Okay.
the showing part and not the growing part, or which
It can
part
help
of it?
with both.
Okay.
Yes.
That's good to know.
Yeah.
So let's say I come in, I'm girthier. I'm girthier when I leave. How long until I get back into the ring?
Oh, I mean, you want to give it a few weeks.
Yeah.
Yeah.
Weeks?
Weeks?
Well, yeah. Okay, so we have some aftercare that you do.
Okay.
We do like you to massage. And I'm not going to do the hand movements.
You almost did.
I almost
You
did.
almost did. I almost got you.
Yeah, but yeah, I mean, it's, yeah.
And how long does this last for?
It lasts around a year. So hyaluronic acid is indicated for a year. But once we call it residual filler, which not a lot of people talk about. It should be talked about more. But some fillers can last forever or years. So when you layer filler on top of filler on top of filler, yes, your body does get rid of some of it. But most of the time, it doesn't get rid of all of it. So eventually, you might have to do less as you build.
Are there any misconceptions that you hear about this type of procedure, or is it pretty straightforward?
I think people think it's going to be super painful. That's probably the
Yeah,
biggest
that would be
one.
my biggest
Yeah,
concern, for sure.
yeah, because you would think it's a sensitive area, but no, it's not. It's really not bad.
Right.
We numb you. We have no complaints as far as pain goes.
So with Boss Beauty, and we'll get back to Brian, do you have any more questions about the penile process? You're good? Okay, he's good. So
Brian's angry because he knows it's true.
Brian just wants to be girthier, okay? We'll talk about this after. You can't really, when guys come in, do they bring pictures of like male celebrities that they want to look like they're getting a haircut? Or is it more along the lines of you can't really change the way they look other than just making them look younger and less tired? Would it benefit you if I brought in a picture of like Ryan Gosling and I say I want to look like Ryan Gosling? Does that do anything for you? Or does
I feel like it has to at least be kind of similar.
maybe.
Yeah, I would say you need to go see a surgeon.
So it's one of those situations. Gotcha.
I mean, it's got to be realistic. So we talked about like realistic expectations. Yeah, it's got to be realistic. So if it looks nothing like you, and I have a lot of people come in that say like, I want this, and it's a whole filtered face.
Yeah.
And sometimes it's just not really realistic. And I think that this day and age, we have a lot of that because of our society and like
Sure.
the magazines and Instagram and all the filters. People think that it's real when a lot of the time when it looks that perfect, it's probably not real. It's probably a filter, but
Are you able to tell which celebrities are getting some bad Botox or like any celebrities that you're like, oh, they definitely.
Or just
Yeah.
like bad services in
Yeah.
general. Because I've seen like bad filler done before.
yes,
Yeah.
for sure. Yeah. Yes, definitely.
Is
Anytime
there-
I see a movie, I'm like,
Yeah. Is there any celebrity
There's-
that stands out right now? Let's say male celebrity, because I feel like
Okay,
males are
male
probably
celebrity.
easier to make fun of. Is there anybody that stands out that was attractive that you're like, they don't have that look anymore because they look too whatever?
Yeah, I would say maybe Zac Efron, only because I feel like
T.
that's the one that sticks out the most right now.
He had something happen to him though, didn't he?
But see, I don't know the truth.
Yeah.
I don't know the
Yeah.
truth. So I think it's probably a combination. But also I've seen some photos online that look like they've been altered with filters or other apps. So I don't really know what he looks like, I don't want to
We'll get Zac Efron on next. Julie, can you
Yes,
work
Yeah.
please.
We'll
yes.
ask him.
And invite me back.
and invite Boston back? Yes.
Is that's like your celebrity crush or what?
I mean, I love Zac Efron. Yeah, he's great.
He's funny. I like him.
yeah.
He's a good guy.
I don't really have celebrity crushes, really.
Really?
Fair.
Yeah.
Why?
Yeah. They're just normal people, and
I just meant
don't
like
know.
appearance-wise, I guess.
Appearance-wise?
Like a cute
Okay.
celebrity.
Yeah.
He has a strong jawline, I feel like. You like the
Yeah,
jawline?
he is a little bit more like manicured. I do like a manicured guy for sure. So
Okay.
yeah,
You like the manicured guy more than the all natural look?
both can be good. There is a place for both.
What about the rough
But
and tough?
What about when they have green polka dots on their forehead?
They have green polka dots all over their face and their hair's all messed up. How
This
do you
is
feel
the
about
look that I go for.
This is it. This is what you're looking for right here. Exactly. We're going to be on the next episode. People are going to be like, what show am I watching? Who are these people on this episode? It's going to be
know.
great. I can't wait.
Instead of Big Head, we call it Boss Beauty Head.
Boss Beauty.
Love it.
This episode is sponsored by Boss Beauty. It's going to be great. Dr. Boston Crockett at your service.
Thank you.
Boss Beauty, bossbeauty.com.
Yep, bossbeauty.com.
BosBeauty.com?
Yep, Boss Beauty with one S.
1S.
And what's the social media?
Yep. Mine is the Boss Beauty, one S. And then we have Boss Beauty LV, which is the business here in Vegas.
Wonderful.
You call everybody babe too, don't you?
It's branding, babe. Yeah.
Babe.
It's branding, Julie.
Come on, babe.
Did you know that?
I don't say it as good as she does.
No, Boston has plenty of experience saying babe. Ever since the first time I met her, I think she called me babe. And I was
Yeah,
what
I
did she
love
just
it.
call me?
I love it.
I love that. Well, boys and girls, this was fun. Boston,
fun.
thank you
Thank
so much
you.
for coming on.
Thank you for having me.
Check out Boss Beauty here in Vegas and St. George and Salt Lake on social media. Watch next episodes and see how different we look after we go in and get our work done.
No.
Yes. Check out new episodes each week on heybighead.com. Any last words, Julie?
Bye.
Very nice.
Yay, that was so fun.
Great.
Thank you guys.
Thank you.